So what I'd like to do now is introduce our next speaker. I'm an adult physician, and I spend my time looking after adults who have lung disease, but I suppose one of the things we want to promote today is lung health and attaining the maximum lung capacity you can. And of course that happens in childhood, and the lungs continue to grow often until the late teens, and so it's so important for children to look after their lungs. And with that, I'd like to introduce Dr. Basil Elnazir, who's a respiratory paediatrician in the National Children's Hospital and also a medical officer with the Asthma Society. And Basil's going to talk to us about paediatric lung health.
Thank you very much, Ed, for that introduction. It's very hard to follow on Dr. Delaney and Professor Gay after that very exciting talk. I'm a pediatrician, and we feel that we look after the future. So if we have children that grow up healthy and they end up in a good shape, we're going to put our colleagues, the other physicians, out of business. So that's our plan, to put them out of business by having very healthy young people growing throughout. So we heard a lot about the lungs, those two very vital organs, and again we take pride. I'm a respiratory pediatrician, and this is the main target organ that we like to keep healthy throughout. I'm not going to go over this again, but very quickly, Professor Gay has spoken about those, the analogy of a tree and branches and ending up in leaves, or the little air sacs down at the very bottom, where we exchange all the gases, and a lot of things happen down there. So you can imagine anything can go wrong. If you have any problems along those trees, along the branches, along the air sacs, many things can go wrong. An interesting thought that's emerging now, particularly between pediatricians and other physicians, is that we tend to think that there's a growing interest in the area of early events that happen in life and the way the disease is expressed later on in life. So for example, we now are more interested in what happens in utero, so even before the child is born. So there are some maternal factors, and there are obviously newborn factors, childhood factors, and other factors. But all these with environmental risks, and we spoke about air pollution, we spoke about the biomass, fuel, and other environmental interactions that would eventually lead to way a disease can be expressed in adulthood. As I said, I'm a pediatrician very much interested in growth and development. I'll be interested in what happens at this stage, and certainly what continues on later on in life. Smoking is bad, and we all know this. And this evening is not about smoking. As Ed said, that people will say, this is a lifestyle choice, this is their problem, you know, they've chosen this. If we stop smoking, everything is okay. But it's very important for us that, you know, if we're looking at early life events, that we look after the unborn child. And there's a lot of evidence to support that exposure to tobacco smoking in utero can later on lead to chronic illnesses in adulthood, such as chronic obstructive COPD, chronic obstructive pulmonary disease. But we know for sure, and when we talk to our parents, the parents of young children, we know that smoking would lead to decreasing the lung function during early infancy, later on in childhood, and as well can lead to wheeze, asthma, and lower respiratory symptoms. We spoke about pollution as well, and that's an important factor, the particulate matter, and what it can do to the lungs. We heard a lot about exercise, and Professor Gain has shown us all these athletes, which I'm a pediatrician. When I sit in my clinic and this 8, 9-year-old come to me and say, well, I've asthma and I don't want to be playing or to play sport and so on. We have the posters of Gordon O'Gara and Sean and many other trained, Dennis Hickey, etc. And we say, look, these are very accomplished athletes. They have asthma, but they can exercise. The problem being is, if we portray the image that this child has got lung disease and we have to monitor the child rather than train the child properly, we might end up into a major problem which we're facing now as pediatricians. 1/4 of the children in Ireland are overweight or obese, and 75% of these obese children will become obese or overweight as adults in adulthood. So, and we know that in obesity or obese children will have significantly lower lung functions compared to non-obese children. So obesity is a major problem. So one way of looking after your lungs as a child is obviously to exercise and hence minimize the risk of obesity. If you ask me what do I do in terms of respiratory conditions that I meet in my everyday practice, okay, we look after children who are born prematurely, and now that we're knowing so many things about premature birth, it's hopefully getting less and less by looking after the pregnant mother and so on. So children having chronic lung disease as a result of premature birth. I look after children with pneumonia, and these are infections, and they're quite a lot, and Sean spoke about the risk of cross-infection, having vaccination to minimize all this. Of course, we look after asthma, which is the commonest respiratory condition in Ireland. 1 in 5 children will have asthma. We look after children with cystic fibrosis, and children as well with, as a result of obesity or many other factors, can have obstructive events during sleep, what we call obstructive sleep apnea. So the fact is that an international study of allergy and asthma in childhood found Ireland to be the 4th in the asthma league worldwide. So as I said, 1 in 5 children will have asthma. Now the incidence, the asthma, we have about just under 500,000 adults or people with asthma in Ireland, and the sad statistics that we're not very proud of is that there will be 1 death a week, roughly, of asthma or asthma-related illnesses. Needless to say, there will be a lot of cost implication as a result of poor management of our asthma. Again, I will try at this point just to tell you that asthma, unfortunately and sadly, can still kill children, and that's why, as part of our campaign in the Asthma Society, that we try and promote proper asthma management for school children. People can get information from the Asthma Society website, and I'm not advertising for the Asthma Society here, but just because it's such a common condition that I would like parents of children with asthma to visit this website, because we have information on how to properly manage asthma and how properly use the inhalers. Plus, to try and connect with the digital now and the younger generation, we have launched our free app for asthma coach for proper asthma management. There are a few myths about asthma, that will my child outgrow asthma, will antibiotics help, do I use a nebulizer, and all this information will be found in the website. Cystic fibrosis, we're very proud, we're very glad that we started the screening for cystic fibrosis in Ireland on the 1st of July 2011. So we're 2 years on since we started the newborn screening, and this is done through the Guthrie card or the heel prick test, which all children born will have in Ireland will have this done. And thankfully, by doing so, we help to recognize the condition earlier, deal with it more appropriately, and try our best to minimize any issues and improve their nutrition, so that this young person, when he or she grows as an adult, we transition them to Dr. Bacone and our other colleague who deals with cystic fibrosis in as better shape as possible. And that, again, has been a very positive move for cystic fibrosis. Plus, we're having a lot of targeted therapies these days, and this is a huge area of development in the care for young people with cystic fibrosis. So, what I would say here is that chronic lung disease of adults has its origins in probably in the unborn child and later on in pediatrics. There are a lot of programs looking at pregnancy, and of course one should not neglect the element of genetic, because yes, some of these diseases have got a genetic component, but the way the environment interacts with the illness as well, and the long-term adverse reaction that we have on the respiratory health of the child might certainly lead to having an adult with very poor lungs. And we heard about the lung being a very important part of that car to drive. So one thing we as pediatricians want to do is to make sure we look after the lung health of the child. So if I leave you with this message, obviously it's all about being informed about your children and grandchildren to improve their lung health, look after their lungs. Vaccination is a very important part to prevent any respiratory complications, because there's so many conditions that can lead to long-term respiratory problems. Make sure that the children are actually taking their medication appropriately. If they're diagnosed with a condition, try and minimize any further lung injury through smoking, pollution, and certainly try and safeguard against obesity and to maximize the lung health. Thank you very much.